There are 5 subtle warning signs that an elderly person may be nearing the end of their life that you should not ignore. Over the past year, has someone you care about begun exhibiting subtle but worrisome changes? Many people believe that old age and death come quickly. But in reality, the body frequently gives silent signals months or even a year before life reaches its end. The issue is that most people overlook these indicators because they initially appear to be minor. Families only discover the hints were present all along when they look back. But by then it's too late to make those final memories matter or to prepare. In this video, we'll discuss 5 important indicators that frequently show up a year before an old person dies. You may have noticed some of them but dismissed them as simply signs of aging. Others may be seemingly insignificant alterations that actually indicate the body's slow deterioration. Early detection of these symptoms allows you to deliver better care, treasure special moments, and, above all, make sure that your loved one's last days are peaceful, dignified, and comfortable. Keep reading through to the end because these 5 indicators can help you get ready for what's coming up both practically and emotionally. You won't be taken by surprise if you know what's going on. You'll be able to maximize your remaining time with the people you care about. Let's get going now. First, a noticeable reduction in body weight. Unintentional weight loss is one of the first and most obvious indicators that a person may be nearing the end of their life. It may appear inconspicuous at first, like a belt that needs to be tightened, clothing that seems looser, or a once strong appetite that starts to wane. Losing weight without trying is rarely a good sign, but many families ignore it as a natural part of aging. It frequently means that muscle mass is declining, vital processes are slowing down, and the body is no longer absorbing nutrients effectively. Muscle loss is a normal part of aging, but if it occurs too quickly, it may indicate a more serious issue. Muscle wastage may result from the body's inability to adequately digest meals or from a person's inability to metabolize protein. In addition to making walking more challenging, this loss of strength impairs immunity, makes the person more susceptible to illnesses, and raises the chance of falls. Changes in appetite are another factor contributing to weight loss in the last year of life. Many older people simply no longer feel as hungry as they once did. Their taste buds deteriorate, food loses its appeal, and they may begin to skip meals or eat considerably smaller portions. This is a physiological shift rather than merely a question of taste. The body no longer alerts the brain to look for food as frequently when it senses that it is starting to shut down. Less strength, less vitality, and a slow deterioration in general health are the outcomes. Furthermore, underlying medical issues also play a part. Chronic conditions like cancer, heart failure, and kidney illness can all start to advance long before more overt symptoms show up. And weight loss is a common indication of these conditions. Reduced eating can result from even mental health issues like depression or cognitive decline, which can set off a downward spiral in which the body isn't getting enough energy to function. By serving beloved dishes, encouraging loved ones to eat more, or adding protein drinks to meals, some families attempt to address the issue. However, it's crucial to understand that the problem is not just diet, rather, it's the body getting ready for a more profound shift if the weight continues to decrease in spite of these attempts. Forcing big meals at this point might not be helpful. Instead, emphasize easy-to-eat comfort food. Maintaining one's quality of life might be more significantly impacted by food and hydration. It's time to take notice if an aged loved one exhibits noticeable weight loss, particularly if they're eating less, feeling weaker, or finding it difficult to maintain their level of activity. This is about the body conveying a message, not just about beauty, and by grasping that message now, you can be better equipped to face the future with compassion, clarity, and the capacity to make the most of every minute that remains. The second is tremendous weakness and exhaustion. A profound, enduring exhaustion that does not go away with rest is one of the most obvious changes in the year before death. After a long day, it's not just a slight fatigue, it's a deep exhaustion that makes even easy chores seem impossible. It gets difficult to get out of bed. Activities that used to feel ordinary, like dressing, cooking, or even just having a conversation, become too taxing, and even walking across the room takes effort. This is an indication that the body is preserving its remaining energy and is not only a product of aging. The body starts giving priority to what is most important when organ activity slows. Muscles receive less oxygen than they used to. Circulation deteriorates, and the heart's pumping efficiency declines. This explains why a large number of senior people in their last months experience weakness, instability, and an inability to maintain the same degree of activity they used to enjoy. Metabolic slowing is another important component. Although the body is made to generate and use energy, this energy is redirected as it gets ready for its last stage. The body changes its focus from promoting movement to preservation. Because of this, a person in decline may begin to sleep more, require longer naps during the day, and struggle to remain awake for extended periods of time. Some people may even suffer from abrupt energy declines, appearing okay 1 minute and then being totally exhausted the next. The psychological effects of exhaustion, however, are arguably the most tragic aspect of this process. Many elderly people who used to be proud of their independence start to feel angry or even ashamed because they are unable to perform their former activities. They might stop participating in activities, avoid social situations, or retreat from talks. They just don't have the energy. Not because they don't care. This might result in a vicious cycle of loneliness, where they give up completely, which only makes the decline worse. It can be difficult for families to witness a loved one transition from involved and active to worn out and reclusive. It's simple to believe that they must overcome it or that they're simply being lazy. In actuality, however, forced activity won't be beneficial. The most important thing is to recognize their limitations, give them time to rest when necessary, and make the rest of their days as comfortable as possible. Take it as an indication that a loved one's body is undergoing a significant transformation if you observe them suffering from intense, persistent exhaustion that doesn't go away with rest. Now is the moment to value dialogue, provide peaceful periods and offer undemanding assistance. Because their ability isn't the most important factor in the end. It's because they feel comfortable, understood, and cherished. Please let me know in the second remark below if you're still watching this video and finding these ideas helpful. To ensure you don't miss any videos, I advise you to subscribe and turn on the bell if you haven't already. We can keep producing high-quality content to educate and uplift you thanks to your support. Let's go ahead now. The third is a rise in cognitive disorientation or disengagement. One of the most noticeable changes that occurs when a person nears the end of their life is in the way they think, speak, and engage with other people. Someone who used to be alert and involved may start to forget things more frequently, have trouble following discussions, or appear lost in familiar settings. Even if they have never experienced memory problems before, they may repeat themselves, forget names, or lose track of time. It is possible for these minor cognitive alterations to occur months or even a year before death. This amnesia isn't normal. For optimal operation, the brain needs a constant supply of oxygen and nourishment, just like any other organ. However, cognitive performance begins to deteriorate as circulation slows and the brain's oxygen supply diminishes. The person could fail to recognize people in settings they've known for years, get easily confused, or have trouble making judgments. In certain instances, they might even experience brief periods of clarity interspersed with abrupt bursts of bewilderment, as though their mental state is intermittently vanishing. Emotional disengagement is another typical symptom. People who are nearing the end of their lives tend to become less interested in social situations. You may observe them sitting quietly over extended periods of time, speaking less, or interacting less. Their brain no longer registers emotions and involvement in the same manner. But it doesn't mean they don't care about their loved ones. Many seniors eventually withdraw into their own world as a result of loud surroundings, exhausting conversations, and a sense of overwhelm. Additionally, You can observe behavioral and emotional shifts. Some people become more easily agitated, nervous, or irritated. Others appear abnormally composed, aloof, or unconcerned about things that used to be important to them. This is frequently the result of the brain adapting to the body's deterioration. Not just a change in personality. Emotions become more difficult to communicate when cognitive function declines, and the person may no longer respond to events in the same manner. Family members may find this stage particularly challenging. It can feel like losing a loved one before they're truly gone when you watch them lose their sense of reality or emotionally distance themselves. But it's crucial to keep in mind that they have no control over this. Meeting them where they are is the best course of action rather than attempting to reintroduce them into the discourse. Talk softly, reassure them, and know that they can sense your presence even if they don't always react. Don't dismiss a loved one's increasing forgetfulness, confusion, or lack of engagement. These are frequently early indicators that the mind and body are getting ready for the big change. Now is the moment to exercise patience, value quiet time, and concentrate on establishing a space that feels secure, comfortable, and tranquil, because comfort and love endure even when words fail. Let's go on. Fourth, delayed healing and recurrent infections. A compromised immune system is one of the most obvious physical indicators that the body is winding down. Someone who used to get sick infrequently suddenly appears to get every cold, flu, and minor ailment that passes around. Simple wounds like a small cut or bruise heal visibly more slowly. And infections that were once trivial now take a lot longer to recover from. These shifts aren't arbitrary. They are indicators that the body can no longer protect or heal itself as it used to. Recurrent infections are one of the main issues. As the immune system deteriorates, the prevalence of pneumonia, UTIs, skin infections, and even mouth infections increases. A lot of families believe these are isolated illnesses, but when they become common or take a long time to heal, it's usually an indication that the body is losing its defenses. Even once quick-acting antibiotics may now seem less effective. Stronger drugs, longer recuperation times, or further rounds of treatment for infections that were previously minor may be required. This occurs because the body just doesn't react to treatment as well when circulation decreases and organ function deteriorates. Chronic wounds are yet another neglected problem. A weakened circulation may be the cause of minor cuts, sores, or bruises that don't heal properly or continually reopening. Healing is significantly slower than usual when there is poor blood flow because oxygen and nutrients aren't getting to the skin and tissues effectively. If pressure sores are not properly treated, they can become hazardous and can result in infections, especially for people who are less mobile. Even more worrisome is the fact that infections in the last year of life frequently don't appear as we might anticipate. An senior person may appear more exhausted than normal, more disoriented, or less hungry instead of having a high fever. Actually, a sharp drop in mental acuity in the elderly is frequently the initial indication of an infection, even before additional symptoms manifest. Because of this, identifying these changes early on can greatly ease their later stages of life and provide them with care. It can be heartbreaking and distressing for families to see a loved one suffer from recurrent infections. Pushing for severe therapies in the hopes that one more hospital stay or round of antibiotics will solve the issue is alluring. However, the emphasis frequently changes from healing to consoling after a while. Keeping them hydrated, maintaining clean and moisturized skin, and reducing stress on the body might all be more beneficial to their health than taking more medicine, which just makes their problems worse. Please let me know in the fourth comment below if you're still viewing this video and finding these ideas helpful. To ensure you don't miss any videos, I advise you to subscribe and turn on the bell if you haven't already. We can keep producing high-quality content to educate and uplift you thanks to your support. Let's go ahead now. The fifth is significant alterations in breathing or circulation. A discernible shift in respiration and circulation is one of the most obvious indicators that the body is getting ready for its last phase. Your loved one's breathing may seem shallower or slower than it used to be. Their respiration may occasionally become erratic, accelerating and then suddenly slowing down, or they may pause in between breaths. Cheney-Stokes respiration is a mild, rhythmic breathing pattern that some people have. It alternates between deep, fast breaths and extended pauses. Although these changes may begin slowly, they gradually become more noticeable and frequent. Weakened circulation is another typical symptom. Their nose and ears may become cold to the touch, as well as their hands and feet. The skin, particularly around the fingers and toes, may seem mottled, pallid, or bluish. This occurs as a result of the body lowering circulation to the extremities in order to prioritize blood flow to essential organs. It's an obvious sign that the heart isn't pounding as hard as it used to. Additionally, even with little movement, some persons have increased dyspnea. They may feel exhausted or out of breath just by sitting up, talking, or changing positions. They might need to pause and catch their breath while speaking, or you could notice that they breathe more frequently through their mouth. Their lung function may be deteriorating if they used to be able to go across the room with ease but now find it difficult. Breathing may become more challenging in certain situations due to fluid accumulation in the lungs. A chronic cough, gurgling noises, or even a constriction in the chest may result from this. Many people think it's just cold-related congestion, but among older people who are dying, it's frequently an indication that their lungs are failing. They might prefer to sleep propped up on pillows or in a recliner to ease their breathing because laying flat can be difficult. Seeing these changes can be distressing for family members. It's normal to fear that something serious is occurring, to want to help, or to urge them to breathe more deeply. However, this is often just the body's natural slowing down mechanism. While there are methods to make these modifications more pleasant, there may not always be a way to undo them. Discomfort can be reduced by providing little sips of water, keeping the space cool, or using a humidifier. Medication or oxygen treatment may be helpful in certain situations, but the emphasis is placed on comfort rather than attempting to resolve the problem. Pay attention if you observe any of these symptoms, such as bluish skin, cold hands and feet, or changes in breathing. These are frequently signs that circulation is slowing down and the body is conserving energy. Now is the time to be in the moment. Provide comfort and establish a calm atmosphere so they feel secure and comfortable. Comfort, dignity, and the awareness that they are not alone are more crucial than medical assistance during these last few months or weeks. Last words. As this video draws to a close, pause to consider the topics we have covered. Notable abnormalities in respiration and circulation, severe exhaustion, cognitive impairment, frequent infections, and significant weight loss. In the year preceding an elderly person's death, these 5 indicators frequently manifest. When you begin to see them, you'll know that the body is getting ready for its last change, even if they might not all occur at once or be immediately apparent. Many families may find it challenging to adjust to these changes. It's normal to want to push past them, to motivate a loved one to eat more, to exercise more, or to endure fatigue. However, there are instances when listening to what their body is telling us is the wisest course of action. We may concentrate on making their remaining time as pleasant, meaningful, and serene as possible rather than attempting to change the inevitable. Being aware of these indicators is about being ready for death, not about dreading it. Early detection of these changes allows you to provide better care, make critical decisions in advance, and guarantee that your loved one's last months are spent with dignity and affection. It's a time to share tales, treasure moments, and let them know they're not alone. Take a deep breath and keep in mind that you are not traveling this path alone if you are seeing these symptoms in a loved one. Although it is never easy, knowing what to expect can give you calm, patience, and strength. Many families have been on this journey before. We appreciate you being here with us today. We would be delighted to hear from you. Tell us about one thing you learned today and how you intend to apply it in your life in the comments section below. We value your opinions, so please feel free to express them. We are greatly inspired and encouraged by reading your remarks. Please like, subscribe, and share this video if you found it entertaining and useful. We can keep producing high-quality content to educate and uplift you thanks to your support. We appreciate your time and hope to see you in the upcoming video.